All right, Todd Minerson from Movember now joins us again, his third time with us here on GTC. Todd, welcome back to the show.
Thanks for having me, Adam. It's great to be back, and it's amazing to talk about men's health with you guys and the important stuff you're doing on Golf Talk Canada. So really appreciate it.
100%. So, Movember has been the official men's health partner of Golf Talk Canada throughout the year. And golf and mental health, they really tie in together, big picture, don't they, Todd?
Absolutely. I mean, golf hits all the right notes when it comes to taking care of your health, whether it's your physical health, your social connection health and well-being, and your mental health. I mean, maybe not sometimes when you're having a rough round, but all of those things are amazing beneficiaries of playing and being involved in golf. But for some of the things that I think we're going to talk about today, it's those social connections, those friendships, those deep, deep friendships that are created enjoying the game of golf, I think that are so important to our health. And every day we find more research that tells us being connected, fighting loneliness, staying socially connected to people, and having deep friendships is one of the most important things you can do for your health.
It certainly is in all walks of health too. And September 10th, well, it's a very important day. It's World Suicide Prevention Day. And there are some alarming numbers and stats about men's health in particular, Todd, about this topic. Fill our audience in on some of these numbers.
Yeah, first of all, Adam, I want to say it's not an easy topic to talk about, and I really commend you guys for making space for it, making time for it. I also know it's something that has impacted the golf world, the golf community quite a bit as well. But in Canada, we really understand it as a men's health problem. The latest stats that we have from 2022 say about 2,600 or more men died by suicide that year. That's about seven every day. We also know all around the world, three out of every four suicides that are completed by men. And for men aged 15 to 44, it's the second highest cause of death for that age demographic. And so, as uncomfortable as it may be, we've got to learn how to talk about it, and we've got to learn how to address it. And we've got to understand that there are things we can do to help people who are struggling with those kinds of decisions.
And in golf in particular, we saw this firsthand with what happened with Grayson Murray earlier this year. And we see these players play professional golf, flying their private jets, making millions and millions of dollars. And then you have situations like Grayson Murray, who obviously fought so many demons. And this is a sport where, Todd, it's quite simply, it's a lonely sport for those who aren't at the top of the food chain. And it was just a crushing loss for everyone involved.
Yeah, I mean, and Grayson's story is so tragic because he was also so open about it and so willing to try to help other people with his own struggles and by normalizing the conversation. And through that, we can see how hard it is even for people who are ready to get help, are ready to try to do things about it. And you point out you make a good point too, Adam, about how those different factors, those complexity of factors are the kinds of things that end up leading people to make the choice to take their life. And it can be, a wide range of things like loneliness, internal pressure. It can be big life changes, whether they're losses of people you love or relationship breakdown, changes in jobs. Obviously, as well, chronic health issues or mental health issues can contribute to it. But it's such a complex web of events that often lead people to make those kinds of decisions that there are really effective ways we can intervene at those spaces and try to help challenge some of those things that people might be going through before it gets to that stage.
It certainly is. And I know people watching, listening, tuning into this interview have been affected by suicide, unfortunately. And it's so sad. And as we look more positively here, if we could, what kind of solutions now are out there to help someone who may be close to doing that?
Yeah, I would say three things, and we can maybe break them down a little bit,
Mhm.
Adam. One is to kind of keep an eye on people that you love and that people that love you by trying to look for some signs of changes in behavior. And the second is learning to how to have like those hard conversations, but helpful conversations around mental health and wellness. And the third is some kind of crisis support opportunities that are out there. But if you're talking about first kind of looking for some of those signs, it can be really paying attention to a person's behavior or big dramatic changes in behavior, whether it's sleeping or eating or showing up to things, whether it's team sports or your regular golf game. Those can be signs that people are struggling with something. Changes in attitudes, behaviors, hygiene can also be signs. And of course, if someone is really speaking, not obsessively, but frequently about death or dying, it can also be a sign that you really need to engage in a conversation with them. And we know those conversations are hard, man. They are really
Mhm.
hard to have. And we've helped craft a tool that's an evidence-based tool here at Movember called ALEC.
Mm.
And it's for simpletons like me. It's a nice, easy acronym to remember. It starts with an A for ask how somebody's doing, and really break through that I'm doing fine and moving on to the next thing. Really try to break through and understand how you're really doing. Are you happy? Are things going well? Is work okay? Is the family okay? But asking those questions, even if you have a hard time breaking through, shows the person that you care. And that can be the way to wedge the door open sometimes. And when you do that, then you got to listen. That's the L and Alec. It really is a skill to active listening and figuring out what somebody's saying and kind of feeding it back to them. The E is probably the most important step. It's encouraging to take action. And even if it's the smallest thing, like making yourself a good meal or booking that appointment to see somebody or making that phone call that you're putting off, encouraging some kind of action is really vital. And then lastly, checking in, coming back in a day or two and saying, how did that go? Did you do it? It really shows that person that you still care. So this ALEC model is really something that people can use and can get better at in terms of having these kind of hard conversations.
That's very well said, my friend. And I understand as well, there's a confidential hotline someone can dial if they are really feeling down. Can you tell us about that?
Absolutely. You know, Canada last year started a suicide crisis hotline. It's 988. You can dial or text it from anywhere in Canada. If you or someone you care about is really in a crisis moment or struggling, you can call or text that line anytime. You get skilled, trained, confidential, non-judgmental help. It will direct you to services that are close to you. And it's really, really an important service for people who might be at that point, or not only if they are themselves, if they're caring about somebody they think that might be at that point. I can't recommend it highly enough. It is going to save lives in this country. And it's something that we're really proud is part of our kind of fabric of care here in this nation.
Well, thank you for sharing that. Movember, such a huge part of that with mental health and prioritizing our mental health. September 10th, World Suicide Prevention Day. Now, Movember has been the official men's health partner of Golf Talk Canada throughout the year. We have really enjoyed the partnership, as I know you guys have too. And Todd, I understand on a bit of a lighter note now that throughout the summer. There have been some fun stories, perhaps, from charity golf tournaments. Tell our audience about that.
Yeah, I got the chance to do a little bit of the charity golf circuit this summer and meet a lot of Movember supporters across the province. I usually station myself at, the putting green
Yep.
competition or some other ridiculous place where I don't have to show my own swing. But it was really remarkable to hear from like literally dozens of people how excited they were to hear Golf Talk Canada having this kind of partnership about thinking about men's health outside of November, about the ways that golf contributes to it, and just I guess the courage and bravery to have these conversations on a golf program, which is like still part of the partnership that really gives me great joy, that we can do this with a new audience and a new place. But yeah, there were several golf tournaments where like, oh yeah, I've heard you guys on Golf Talk Canada. So I want to make sure that people out there heard that. And, as we get closer to mustache season here coming up in November, would love to see, the golf community in Canada join in and raise some funds and awareness for men's health.
Well, I'm glad you mentioned it there because it's early September now. Movember is just around the corner. How excited are you to not only grow the mow yourself, but see so many mows being grown for a great cause?
We're looking forward to an amazing year. You might be able to see on here my little preseason mow is going.
Okay, I like it.
It's going to be here for a couple of weeks before November starts, and then it'll get shaved down to nothing. But Yeah, we had 50,000 Canadians last year all mobilized behind men's health. Lots of ways to get involved, including growing a mow or moving and doing some physical activities or hosting an event. It's just like this time of year for us is almost like getting to Christmas. We are getting really excited. We get all the phones ringing off the hook. We have people coming up with, outlandish ideas for outlandish mustaches, and there's nothing better to tackle a really serious issue by having a little fun with it. And that's why, even today we can talk about the importance of suicide awareness and suicide prevention, but we can also say, hey, you can make a difference and you can be part of this and you can have a little bit of fun doing it too.
Well, all of us at Golf Talk Canada will be growing the mow for Movember. We have a date scheduled at the Mow House just before
Yes.
Movember, where we'll all be shaven down to the wood and then growing some mustaches for a very, very important cause. Todd, thanks so much for your time today. Really appreciate all of your insight and everything involved today, and hope to have you on again soon.
Thanks, Adam, and thanks to you and Mark and Bob as well for the great support and all the golf community in Canada for letting us share the airwaves with you.